I don't believe in the word incurable, and that's a medical belief I had to change. I came from traditional medicine, anesthesiology, intensive care, trauma. I was trained to look at disease, understand pathology, and treat what was happening physiologically. But after 17 years of practicing bioelectric medicine, I started asking a different question. What if the body isn't broken? What if it's just not getting the right signal? Our bodies were designed to adapt, repair, and self-correct. But look at the world we live in now. The air we breathe, the water we drink, chemicals, technology, chronic stress, medications, poor sleep, emotional stress, environmental exposure. It's too much. Our bodies are continuously being asked to adapt. And they're adapting to a lot of things that may be robbing us of our health. Changes in industry, in technology, in air quality, the filtered water we drink, the air we breathe, food changes, the hits on us from every possible angle. These have caused what I believe is one of the biggest obstacles to our body's ability to self-correct, and that is chronic inflammation. This is one of the reasons bioelectric medicine has completely changed the way I look at healing. The speed at which I personally watched inflammation decrease has blown me away. A chronically swollen ankle, bioelectric medicine reduces that swelling in 15 minutes. A swollen knee with a meniscus tear, 20 minutes. A horse with a swollen, mushy hock, 15 minutes. And it was gone 90%. I've seen it again and again in humans and animals. Bioelectric medicine also appears in my clinical experience to help settle the sympathetic nervous system, the fight or flight state, and allow the parasympathetic nervous system to come forward. It resets the vagus nerve, it puts the brain in an alpha theta state, a meditative state that lets our minds expand, but also relax. We have been in a high sympathetic state for a long time, one that seems to be unrelenting. Why does that matter? Because the body does not repair efficiently when it is constantly under attack. In a sympathetic state, the pupils dilate, blood flow is redistributed, blood vessels constrict in some areas and dilute in others, heart rate and cardiac output can increase, breathing changes, accessory muscles in the neck may be recruited to help us breathe. In shallow but powerful breaths, the body prepares to run, fight, or survive. How can a body focus on repair when it believes it's fighting for survival? And what happens when we don't stay in that state for 5 minutes, but for years? The body has difficulty finding its way back to a calmer parasympathetic state. Stress hormones and neurotransmitters continue signaling. The body stays on edge, on call, ready for anything. Many of us have been living this way for years. It's very detrimental and it can be deadly. And what do? We add more. We take more supplements. We do more healing modalities, more procedures, more medications, more of everything. At some point, are we helping the body or are we adding even more physiologic noise? Because here's something I've learned. More is not better. I recently treated an adorable 5-year-old with an ACL tear. He was already receiving medications, cold laser, PEMF, acupuncture, lymphatic work. Many of those things can be very helpful. But my question was, how is this dog dad going to know what is actually helping the pup? And how will I know what bioelectric medicine does when his body's being exposed to 5 or 6 different modalities at the same time, at the same week? I've seen this same thing with humans for years. They're doing 12 detoxes at once, 22 healers, 25 supplements, acupuncture, ozone, IVs, red light, hyperbaric chamber, peptides, prescription meds, lasers, surgery, and then they come to me. Sometimes when a client is in this overtreated state, bioelectric medicine doesn't produce the response I normally expect to see. And that took me a couple years to figure out why that was happening. Then I realized this body wasn't able to adapt to anything because the person was doing 12 detoxes. Things like acne wouldn't change, or the swelling didn't decrease the way I usually see it decrease. So I started asking, can the body effectively process, integrate, and respond to this many different interventions at once? At some point, I imagine the body saying, hey, what exactly do you want from me? In anesthesiology, we talk about polypharmacy, the use of multiple drugs. Of course, there are critically ill surgical patients who need multiple medications, different drips, blood products, infusions, in addition to, of course, the anesthetic drugs required for surgery. We may be constantly adjusting drips, anesthetic gases, and medications. We're managing blood pressure, ventilation, and fluid status. In some surgeries, we may deliberately lower a patient's blood pressure to help provide the surgeon with a controlled, bloodless field. That's medicine. That's appropriate. But I also work with healthy surgical patients where I watch some anesthesia providers use multiple drugs and drips that I personally did not believe were necessary. Why? There could be many reasons. But the more drugs you introduce, the more variables you introduce. Emergence from anesthesia can become more complicated, and the potential for post-op side effects and drug interactions increases. So my soapbox of keep it simple applies here too. My philosophy was always give the patient only what the patient needed. Not what makes me look smarter or what makes the anesthetic more complicated. What does this individual body really need? I think we need to start asking the same questions in health, wellness, and anti-aging. We are bombarded by influencer in all of these areas. Why are some people doing 2 or 3 lasers? They're doing filler, Botox, all therapy, multiple other procedures, and surgeries within the same time period. And here, I believe the practitioner has responsibility too. We are the clinical gatekeepers. Sometimes our job is to say no. Actually, I think more often than not, we should say no. This is my opinion. Because how do you know what worked if you're doing 12 things? How do you know what caused an adverse reaction? How do you know what your body actually responded to? The same question applies to supplements, prescription meds, weight loss, healing modalities, aesthetic treatments. And yes, I completely understand that when someone receives a frightening diagnosis, the instinct may be to throw everything at it. I understand that. But more interventions can also mean more variables, more possible interactions, and more difficulty understanding what the body is responding to, or in some cases reacting to. Sometimes I will tell clients if they're doing, let's say 12 detoxes, or they have 8 healers, or they're taking 27 supplements, I say pick 2 things, and one of them does not have to be bioelectric medicine. Pick 2, do those things, watch. I give them a time frame to work, see how everything works. I tell them take notes, see what changes in the body, how do you feel, and make note of all that. And then we can assess it. We follow the body, but we give the body time to respond. Then decide what comes next. With this little dog, I treated him for only 15 minutes. That was enough. I could see it in his body. Not only I could see it in the leg, and actually the swelling did go down quite a bit. His eyes became heavy. He settled. He needed time to take in what we had just done. And his leg needed time too. Let the current go to work. I always say this. And cellularly, it's cumulative. So I can always tell when a client has had enough. That's something that's really important, and I think is really missing in medicine, is real-time watching of a client minute by minute. 5 minutes later, this dog slowly got up. He took a step, and then he walked on the injured leg, weight bearing. His dad told me that it was progress. He normally would not put weight on that leg. Does that mean his ACL tear had healed in 15 minutes? Of course not. But his body responded, and now we watch. We assess, we follow the body. Then within a few minutes, he went back to toe touching. That's okay. I expected that. But we learned a lot in that one 15-minute session. And now we build on it. It's the same with bioelectric medicine treatments I offer everyone, whether we're doing a non-surgical facelift, medical work, body sculpting, postpartum restoration, or whatever I'm doing. Each session builds on the last. I tell my clients, let the current go to work. It's cumulative. But also, over time, it gets better and better. In my 17 years of experience, I continue to see changes after the session. And that is a complicated thing, honestly, to explain. I've watched changes continue for weeks. And the number that I've come up with, I tell clients now, is after you finish the last of a series, give it 6 weeks to keep changing, and then we will assess again and see if you need more or not. We make that decision together. I never push a client to do more if they don't need it. Never. Because healing is not a race to see how many things you can do at once. And I'm here to set people free, not keep them in bondage to having to do something every month, every week, forever. Sometimes we need to reduce the noise so we can actually hear the response. So, is anything truly incurable? I don't know, but I no longer accept that word with the same finality I once did. I believe the body has far more capacity to heal than we have ever fully understood, especially in medicine. I now believe our body was meant to heal, and it can, but we have to clear out inflammation, and we have to get the voltage back up in the body and get rid of things like adhesions and other chronic tissue changes that occur. And then 40% more blood flow occurs, and this is part of how we get the body to heal itself. But I also believe the body can heal itself on its own. So, chronic inflammation has interfered with our body's ability to heal. And doing everything at once with many modalities makes it even harder. We can't continue to negate the power of our thoughts, our emotions, or our internal state, the heart-brain coherence, expectation, belief, gratitude. If we believe our emotions can make us sick, then our emotions can make us well. And I believe that. I know this. The way we think and the way we feel create physiological states in the body. So my belief now is that healing requires us to look from a completely different vantage point. Maybe instead of only asking, what disease is this? We also ask, what is preventing the body from doing what it was designed to do? And maybe the body isn't broken. Maybe it just hasn't been getting the right signal.